Hey guys, welcome back to allornonelaw. This is quick pediatrics, and today we're going to talk about the diagnostic criteria for cystic fibrosis. Diagnostic criteria for cystic fibrosis CF, and it's a really very important topic, very common in the phone in some families of Europe and we call Middle East. Okay. So there are two things, the two criteria, main criteria we require. One is a clinical or a history. One is a clinical, and second one is lab evidence. Okay. In a clinical history, one or more characteristic phenotypic features such as COPD, chronic obstructive pulmonary disease. Okay, features of this COPD is present or exocrine, pancreatic insufficiency, sign and symptoms of exocrine pancreatic insufficiency. Okay, then sweat salt loss syndrome, sweat salt loss syndrome. Okay guys, male infertility, okay. So if these sign and symptoms of COPD, exocrine pancreatic insufficiency, sweat salt loss syndrome, or male infertility is present, or the cystic fibrosis in a sibling or a positive newborn screen is there. So in family, sibling you can write is okay, or a positive newborn screen, NBS. Okay, so this is what you call clinical criteria for what you call cystic fibrosis. From a laboratory evidence for used for diagnosis of cystic fibrosis is what you call evidence of a positive sweat test. Very important, sweat test. What is a positive sweat test? A sweat chloride concentration more than 60 milliequal per liter on a sample of at least 100 milligram obtained after a maximal stimulation by pilocarpine, okay, inotroposis. Right. So if it's more than 60 milliequals per liter on a sample of at least 100 milligram, then you can say the sweat chloride test is positive. Or identification of gene known as CFTR mutation, okay, is known to cause what is cystic fibrosis. If you identify two CFTR mutations, then it will help you to diagnose the cystic fibrosis. Then diagnostic nasal potential difference, diagnostic nasal potential difference. Okay, diagnosis of to what you call for a cystic fibrosis requires at least one from each of these. There is a clinical or one of each. Okay, so then you can then you can tell the patient surely that the patient has a cystic fibrosis. Okay guys, so thank you so much for watching this video. Take care.